Good afternoon, everyone. Good afternoon, everyone. Hey, all right. Thank you so much for coming today. This is one of my favorite days of the year. Love getting everyone together, and it's a day that makes us kind of stop and kind of remember and appreciate and respect what is being built at Community Healthcare and what has been built. And today it's one of those days where we're going to look back and appreciate how far we've come, and we're also going to figure out where we are and how to move forward. And so very, very happy to have you here today. What I love also about this day is that it's not just Community Healthcare employees in the audience. We have, I think, about 25 guests who are not Community Healthcare employees, but who work with companies or are involved with other entities that are either partners with us or work with us or are trying to do the same thing as us. And they are friends and partners, and I really appreciate all of them that came. If you are a guest that is not a Community Healthcare employee, but someone that we invited here today, could you just quickly stand up for us, please? Thank you for all of our guests. And we strategically place them throughout the tables, just as we strategically break you all up away from your friends. And I know that you all hate that, but we do it on purpose, sorry. So let's get started. Why are we here today? I think in my mind there were a few things, these bullet points kind of come up pretty quickly. Why do we close our entire company down for a little more than half a day and bring all of us together? And I think these 4 bullet points might be the main reason. Number 1 is to reinforce our mission. We're going to talk a lot about that today. I think, according to HR, Michelle, correct me if I'm wrong, we have over 100 employees that haven't been with us for more than 1 or 2 years. So we want to make sure that everybody knows the history of our company and what our mission is. We teach it when we hire, but we need to reinforce it, and so we're going to reinforce our mission. Secondly, we want to enhance our culture. We're going to talk a lot about what culture is, and I think when you talk about what culture is, I think culture might be the secret sauce of Community Healthcare and why it started with one person 37 years ago, and now it's 300 people in a big room because we outgrew 2 other ones. Number 3 and 4, invest in our people. We want you to get something out of this. We care about you. Our company is built on every person sitting in a chair here, and we want you to get something out of today. I want you to walk out of here thinking something that you think is going to help you in your life. Hopefully it's at work, but I don't care. If it's at home, if it's in your marriage, if it's in your parenting, if it's in a different group, heck, and if it's in another employer someday. We just want to make each other better and invest in our people. And last but not least, we hope that all of these things naturally come down the line and improve our performance. What's our mission? To take care of our patients and our communities. And if all of us in here are a little bit better, we're going to do a better job at that as well, and our patients are going to benefit. So what is Community Healthcare? We were founded in 1986 by Dr. Rodney Eisen. 1 practice in Canal Fulton, 1 physician, his team, and 1 mission statement. And it's grown to this. That's pretty neat. If you were on the original team, I think there are still some left from before retirement. Anybody here that helped open Community Healthcare, or at least came in shortly after? Kim? Amazing. Anyone else? Sharon? Awesome. Thank you guys so much. 37 years. Wow. It's fantastic. What was the timeline? Well, shortly after, Norton joined, and then Massillon, and then Barberton. After that, the 90s looked like they got crazy. Hartville, Louisville, Stoke-Kent, and Greene, all within a few years. As we got over the turn of the century, Peds, Manchester, Wadsworth, Doylestown. Then we branched into physical, occupational, and speech therapy, which we'll talk about. We also branched into OBGYN. Dr. Ruzix, thank you much. And in 2022, Copley. We're in new communities, guys. I love that. What about 2023? We have 2 new ones. Dr. Klatt and his group at Coventry. They came in January. Is Dr. Klatt here? I know he is. And his group. Thank you guys so much. And then, literally a month ago, we opened our doors in North Canton. Dr. Duggan, Dr. Keith, Angela Hisner, and their team have done an amazing job. So we are growing, and I love that. Part of our mission is taking care of more communities, and we're doing that. So, how long have you worked here? We've had the original team. If you've been here a year or less, stand up for me. Wow. Congratulations. I hope you guys know what you're getting into. If you were here between 1 and 2 years, stand up for us. Excellent. Thank you. All right, so if you've been here between 2 and 5 years, stand up for us. Thank you. If you've been here between 5 and 10, stand up for us. Good group. How about between 10 and 15? That's me. Anybody else? 10 to 15? Olson, Rachel, Kelly. Very good. Anybody 15 to 20? Awesome. Dr. Borges, all right. Dr. Borges has the best pictures ever on the slideshow, man. Loved it. Love it. And then if you've been here over 20 years, I know some of the original team. Who else? More than 20. Thank you so much. Wow. So we really want to appreciate our past, and what's amazing is how many people have been here for that long and have really dedicated their lives to our patients and our community. If you have been here, if you started here in the 19s, before 2000, I think there's 20 of you. Would you stand up one more time? Dr. Eisen, you're one. Anyone else? The 20 of you, so we actually have a special gift for all of you. April and Michelle are going to bring it around to you to let you know of our appreciation for everything that you've done. So thank you guys, all of you, for being here more than 20 years, more than 23. That's amazing. So why are we here? To reinforce our mission. Why is a mission statement important? Why do we need to write down in words why we're here? I think it's pretty easy, right? It establishes the reason for our existence. Why are we here? Why is community healthcare here? It sets the purpose of the organization, and it also establishes our goals. And last but not least, this is the one that I really think we do a little bit better job at than others, and that is that it guides our decision making. Our mission creates our purpose. And the book that we're focusing on today, The Power of Positive Leadership, and our guest speaker is going to be helping us go over that. The author, John, says, we don't get burned out by what we do. We get burned out by forgetting why we do it. The mission statement is our why. So what is our mission statement? What was written by Dr. Eisen in 1986? These are the bullet points. To provide our patients with the highest quality, innovative, comprehensive healthcare and healthcare services. To do care that's compassionate, supportive, personal, convenient, and cost-effective. So those first two are about patients, first and foremost. The next two are about each other. We want to encourage education and improvement of everyone and the community outside of our walls. We want to recruit the finest, and I'm biased, but I think this room's full of the finest, to support, encourage our personnel to grow, and to provide pride in our organization. Last but not least, on purpose, it is to operate well in order to stay in business financially. And what's funny is if you do the first four things, the fifth one takes care of itself. And unfortunately, I think you see a lot of other healthcare institutions flip these, right? They put that fifth bullet point first, and that's where they go wrong. And that's where I think, and I hope, and I will do everything in my power, and I know our shareholders will do, to maintain the correct order of our mission statement. The other thing that I think we need to think about is that it's bigger than our patients. He used the word community on purpose. And that's because if we take great care of the patients that come to us, it gets bigger than that. It takes care of the community that you're in. If your community has healthier people, better people, it's going to create a wave. It's going to create a chain reaction. Families are stronger. One of our tenets in mission is cost effective. If we decrease the cost of health care for local employers because their patients and their employees come to us, what does that do for those businesses? Those businesses have more money to hire people, to give people raises, to provide better health care and other benefits. Now all of a sudden, think about this. This is our community. If those businesses aren't paying as much for health care, they've made more profits. And guess what happens when a business makes profit? It has to pay taxes. What do our taxes do? In Manchester and in Green. In Green, they build roundabouts. That sucks. But what do? They build roads. They build schools. It helps our whole community. Maybe the roundabouts don't. Do you know that I came to one of our meetings, the dude was going clockwise around the roundabout? I was like, what is going on? Anyway. But think about this. It's not about just the patient in front of you. And that's a huge thing to remember about our mission. So I looked online here the last couple weeks, and I'm like, is our mission statement really any different, or what's special about it? I found a lot of other healthcare companies' mission statements, and I found a lot of repetitive words, and these look familiar, right? Some of these come right off of our mission statement. Highest quality, compassionate care, treat patients like family, empathy. They all have those words as well. What makes us different? And I think this is what we're going to be talking about today. This is one of my favorite books of the Bible, James, the brother of Jesus. He says, don't merely listen to the words and deceive yourselves, but do what it says. And so we can read the mission statement all we want. We can talk about it all we want. We can put it on the wall. We can put it on T-shirts. But unless we actually do it, those words have no power. And so every day, our goal is to live out the mission. This is an example. This is an extreme example, but I use it. Anybody heard? Some of the younger folks probably don't remember. Older folks, you ever remember a company called Enron? Enron was the darling of Wall Street in the 90s and early 2000s. They were an energy company. They surpassed their financial goals every quarter. It got to be a little like too well. And their mission statement, taken right off their website, uses the word integrity. Turns out they were cooking the books. Did they actually do integrity? They stole millions and hundreds of millions of dollars from everyday people, and they all went to jail. So extreme example, but it gives us more power to the words that we use. What I think is awesome and what really transforms the mission, like I said, all of these companies, everyone has a mission statement, but truly great companies have people who are on a mission. And when you come in, this is a job. You're here to get paid and support your families. But is there purpose for you more than that here? We want that for you. I feel like healthcare is hard. Primary care is hard within healthcare. But I feel like it's a get to do, not a have to do. And so we get to help take care of people. Even when it's hard, we still can help, and it can still fill us up as well. I want to open up the first open mic session of the day here. Do we have people here who are on a mission? Does anyone want to stand up and be brave? What's your job here? Do you have a mission? What is it? Tell us a little bit about yourself. Anyone want to stand? And I didn't tell anyone I was going to do this beforehand to prepare them. But I do have a couple. Renee, all right. Come on up here, Renee.
So my mission has always been to help people. I didn't exactly know how I was going to do that. I did think I was going to be a doctor. And my father was a physician, and he said, you are not going to want to do that. You don't know the paperwork. You don't know the bureaucracy. You don't know the red tape. So I tried to find a different way to help people. And I did home visits for a long time. I was in patients' homes or in communities, and something turned me another way to programming. I still feel like I help people. I help our patients. I think I help some of the staff and the physicians here. So I feel like I fit into community healthcare's mission, and it fits my mission. And I was blessed to have Dr. Eisen as my personal provider. And when he was ready to start a care management program, he asked me to interview, and here I am. And now we have a huge care management and behavioral health department.
Yes, so a few years ago, Renee came to me and said, I really think we need to beef up our care management program. And I said, I wholeheartedly agree. And now today, how many care managers do we have? 11. Anybody raise your hand? Be brave. And transitions of care nurses, and ER follow-up nurses, behavioral health. Great job, Renee. Really appreciate you. Who else wants to be brave and share what their part of the mission is? Ooh, it's a race to the mic. Who's going to make it?
You need to be proud of me for this. I know,
Jen
right?
Nolan, love
But
it.
I wrote it down. Hi, I'm Jen Nolan from the Finance Department. Our mission with the Finance Department is to be support for all the offices, whether you're a provider, or if you're a patient, or if you're front desk, if you're clinical, since we can assist you guys with coding, claims issues, patient billing, everything. So, and we just want to let you know that we do appreciate you, and we're here for you.
Awesome. Thank you so much, John. And I think, just so a lot of you know, our finance department has a heck of a lot more patient contact than you think. A lot of patients have some financial hardships, and that's part of our mission is to figure that out and help them with that. And our finance department has a lot of big hearts, and we really have made it work for a lot of patients that needed us. So great job, finance. Brittany.
Hi, guys. So if you don't know who I am, I'm Brittany. I'm with occupational therapy and with the therapy team. I should talk into this better. So it's not just my mission, but I'm realizing being a part of this company is a really cool gift because there's just not a lot of places you can work where you can just work together with all these other professionals and get the people the help that they specifically need. And so Brent Grass and I have been working together a lot with a friend who we couldn't get to come into the therapy office. So I showed up on my day off and they babysat my kids and I walked in and he and I worked together and he was gonna come to my office actually to try to get the person there. We worked together and we've been communicating a lot, and that's not the only story like that. People don't really fit in boxes, and what it takes to take care of people is just so much more than that. And when I was just an occupational therapist out in the world, I had no idea what my role was compared to physicians, when I should be communicating with them. And what I like too is I realize sometimes when physicians are trying to take care of somebody, they send a referral, they don't know if that person's actually gonna help or if they're gonna say, your physician is a doofus, I don't know why they sent you here, you wasted your time. And so I really like that in this company, I never feel like I'm burdening anybody in any department, whether it's the referrals department, the finance department, the billing department, the physicians. I know that people really care, and so it's cool that we can kind of work together to get people taken care of. And I just don't know a lot of places where you can think outside the box, because people just really, if you're really helping them, they're not gonna fit in your boxes. So I'm just really appreciative of this group.
Thanks, Brittany. That reminded me, how many people in here, providers, have done a home visit or care managers? Physical therapy? That's pretty awesome. Very good. Anyone else want to talk about their personal mission? Is that Bethany back there? Or I can't see.
Hi, I'm Bethany from Pediatrics. I feel like both my personal mission and my office's mission is to treat every person with grace and kindness that we come across. So I feel lucky to work with an awesome team of people who do that every day, and to treat each person that comes to either my office or in our office as a patient like they are the most important patient or person there that time.
Awesome. Thanks, Bethany.
Hi, everyone. I'm Jeanette. I'm from the EMR and IT side of things. To me, the mission statement is what we adhere to every day in our day-to-day lives here at CHC. I started at Community Healthcare 11 years ago. Since then, I've worn many hats, from being clinical in the office as part of back staff to front staff to now being on the IT side of things. I've also been a part of providing care to our patients as well as receiving care as a patient. In the IT department, we have our own mission statement. Pardon me. We strive to serve those who serve others, so supporting staff across all of our offices is super important to me, and I know it's important to our team. I'm also on the educational side of things with training new clinical staff as they are acquired and fostering my own IT growth and knowledge. I've continued to grow in the company. I know many others have. I take great pride in our organization, and I hope others do too. Thank you.
Thanks so much, Jeanette. Awesome. Anyone else?
Hi, I'm Gail from the OB office, and
Gail.
my mission is to make sure that all the people that come to community health care feel like a family. When that phone rings, they're number one, and this is the best place to work, and they're family. When they call on that phone, that is the number, that's where it starts. On that phone, take care of every one of those patients, just like they're one of your family members. I love each and every other patient. We sometimes have our days, but we still do our best, and I got to give it all to Dr. Ruzik's holding down the fort and everything that he does with all the patients and care and love, and we have a great group of girls at our office and our managers, and we're thankful to be part of community health care.
Thanks, Gail. Miss Amanda.
I'm Amanda from the Louisville office, and I have a sign in my hallway at home that says, "We rise by lifting others." And my mission is to return the support that I get from my providers and my team and my coworkers so that we can in turn support the patients and each other. So that's my daily that I see every day when I leave the house.
You certainly do.
Well,
Good
thank you.
job, Amanda. Very good. Well, thank you guys so much for sharing that. I think that's huge because when you come here with, oh, so sorry. I didn't see you.
No, it's okay. Hi, my name's Vanessa. I'm from the water. There we go.
There you go.
I don't do this very often, but I can. No, it's okay. Don't get me one. Courtney would be mad. Okay. So I'm Vanessa, and I'm from the Wadsworth.
Drop the mic.
It's okay. Nothing to see there. Okay. I can't. Don't. It's okay. They're used to this at my office. It's okay. Okay. Anyways, back to it. I've been a nurse for almost 20 years, and I have been here for 2 years in February. This is the first job that I've ever wanted to get up and come to work at. My whole personal mission statement is that I want to make a difference in at least one person's life every day. Even if it's just to tell somebody walking down the street who's looking a little bit sad, "You look fabulous." And I'm kind of extra, have a whole bracelet that says it. But I do believe that I get to do that every day at Community Healthcare. I had a patient this morning, even though we only worked a portion of a day, that said, "I'm so glad you were my nurse today."
That's awesome.
Right. But that filters from down, from above, from our doctors to the support we get from IT because I can't do something without clicking 17 times. And they're like, "Yeah, you can do it in 3. To, I mean, anything, like truly support and everybody looking and saying, okay, like my best thing is the new automated system. Like that gives me time that calls people. That gives me time to do other things.
Yep.
Like, so it's this whole encompassing thing. So I just think from my office manager to my amazing staff that deals with me, I think we're supported and it lets me do what I want to do.
That's awesome.
So thank
Thanks so much, Vanessa. Very good. Very good. Well, thank you guys all so much. You know, I was just reminded of one more story I was told before this meeting today. He'll get embarrassed, but I'll say it. Dr. Bailey had a patient, 101 years old, who lives by herself, who fell, and she opened up her cell phone on the floor, thought it was her son, but called Dr. Bailey's cell phone. Number one, she had his cell phone number. That's cool. Number 2 is she thought it was her son. He probably is like that to her. And Dr. Bailey left the office and went and picked her up off the floor. So those are the kind of things that I think really, really talk about what our mission is. So I want to recap last year's meeting very quickly because last year's meeting I think was very important. We had, if you remember, Dr. B.J. Miller come, and he's a palliative care specialist, and I was kind of disappointed he didn't tell his whole personal story. He, if you guys remember, if you were here, he's a triple amputee, 2 legs and 1 of his arms. He was in a freak accident and was electrocuted, and the current went through his arm and out his legs, and pretty much killed him, and he was resuscitated. He was like 20 years old when it happened. He spent like almost a year, maybe 2, I think, actually never had went home in hospitals and in rehab facilities and getting surgeries, and had this huge experience in the healthcare system, and decided that it changed his life. He then went to medical school and became a palliative care physician. Why did we want to talk about this last year and further our mission? Well, 90% of our American seniors would prefer to pass away in their home, and only 30 do. What is our current state of end-of-life care? I'm sure it's pretty obvious, but the data shows that a little over half of all elderly patients end up in the ER in the last month of their life. Do you think that's a great place to be at the end of your life? This quote I heard at a talk killed me. Healthcare spend, meaning any type of medical care, procedure, hospitalization, ER visit that happens towards the end of a life can be used as a proxy for patient suffering. That just blew me away. Like, think about that. Say it again for the people in the back. Like, wow. And so when you think about it, there's some suffering, and to be quite honest, a lot of suffering that's unavoidable. That's part of life. But where we can be better is in the avoidable suffering, right? What's avoidable? Going to the ER and not having resources at home, not having equipment you need, not having a doctor who you think is your son that you can call to pick you up off the floor, right? If you look at the cost of our care, if cost is a proxy for suffering, look at how high the cost peaks right before death. These poor people should be peaceful in their home with their family, and they're running in and out of hospitals. The satisfaction, or what they did a survey on, was the quality of a patient's end of life. As you go further right, that's the higher the cost. So the higher the cost of their care towards the end of their life, the least satisfied the patient and their families were. What does it cost? It's astronomical. 3 or 4 times an increase in ED and hospital admissions, and doing a lot of aggressive treatments that probably don't improve the patient's total quality of life at the end. So what is one of our, I think this equation could even be part of our mission statement. We increase the value of care by increasing the quality and lowering the costs. So why did we want a palliative care doctor to talk to us last year? Because palliative care can do this for us and for our patients. Palliative care reduces symptom distress by 66%, and those improvements last months after the consultation. The patients that get palliative care have a 93% satisfaction rate. Effective palliative care decreases hospital admissions, which is a proxy for suffering, by half, 50%. Decreases ER visits by 35, hospital ED transfers 40, and lowers costs by 36%. So how did we respond to this when we saw that data? We need to do something about this. And right, don't just read the words and deceive yourself. Do what it says. Take action. What did we do? We partnered. We found like-minded people, some of which are in audience today. We have Empatia here today, one of our main PalCare partners. We have partners that do this for our patients. We have processes. We love our processes. We can refer anytime we feel the need. We also have formal chart reviews that are notifying our providers. Think about PalCare for this patient. What were the results after last year's meeting and after the things that we took action for? We've had over 200 palliative care referrals come out of this room. Those patients have had a greater than 20% reduction in hospital admissions. Hospital admissions are a proxy for suffering. We've decreased that suffering in terminal and chronically ill patients by greater than 20% in 1 year. And this is an amazing thing. You know, you'd want to be on hospice more than a couple of days. What does hospice mean? It means you are at home, being made comfortable, being able to spend your last moments with the people that you love, not in and out of a facility. The average community healthcare patient spends a month and a half on hospice. That's amazing. They get a month and a half with their family that they didn't get to have before. Great job. But you know us. We're community healthcare. We do a little bit more. We started, and if Amanda Dooley could come up here, we actually had more than that to offer our palliative care and end-of-life patients. And it was no coincidence that at the same time we were looking at this data and figuring out that we wanted to get better at palliative care and end-of-life care, Amanda emailed me out of nowhere and said, hey, I took this class where I am an end-of-life doula. Come on up. And I just really feel called to this. Is that something that community healthcare might want to use? I'm like, oh, really? Yeah. And so a lot of you have referred to Amanda this year as our peaceful planning advocate. And I want her to give us a little bit of an update on how things have went since our meeting last year, since we launched this, and what it's done for our patients. Thank you, Amanda. You know what? You might want to use this. Yeah.
All right, thank you guys. So Dr. Sonic just asked us, like, what's your mission? What's it with community healthcare? This is it. Like, this is my baby. Like, I'm blessed to do this every day. So, death is a mirror in which the entire meaning of life is reflected. Just a little food for thought. With my mission, I would say that making death talk a little bit more positive and not so taboo and scary is probably my biggest driving force because it affects all of us. We're all going to experience it. We're all going to die. We're going to have family, friends, pets, loved ones. So I think we really just kind of need that support during that time because it's such a vulnerable state. So this is kind of just a recap of services. We've seen this slide before. Just kind of covers, planning. I can sit bedside with people, which I have done very recently. I did sit bedside with somebody as they were actively transitioning with their family. Just really any kind of support that the family needs at the time. It's very individual to them. So the statistics, my total referrals since we started this last year has been 21, which 14 people have agreed once I got out and I met with them and I talked to the family, which is 67% of the people who have been referred to me have accepted the services. The average length that I've had them on my caseload is 74 days. It is a little bit skewed because you'll see the longest patient I have up till he is still with me on caseload is 350 days. He's doing better than ever. And then my shortest length was 6 days. So some of my stories, Louis was my very first patient that I had. He was 93. He was my pilot program patient. He passed away, and I was at his house visiting with his wife while he was in respite when his daughter called me and said, hey, my dad just passed. Can you stay and sit while I break the news to my mom? So I was able to be there for that moment for support. There was Teresa, who was 61. She had her second bout with cancer. Teresa's biggest goal for end of life was she did not want to pass in her house because she had a young son and her husband who would still be living there. So she didn't want to pass at home. So I was able to kind of sit with her, her family. I met with the funeral director. I helped her plan her funeral, get all of that stuff kind of taken care of, and was kind of just that voice for her as she kind of progressed very rapidly towards the end, like, hey, she does not want to be here. We need to find some respite for her because we're looking at the very end. Unfortunately, she did pass in her home. They were getting her set up for transport and had left and were coming back in within an hour to transport her to respite, and she did pass in the home. So that was a little bit unfortunate, but it was nice to be kind of part of that planning and see the different side of it and reasons why somebody might not want to die at home. And then Bruce and Mary Ann are a married couple. Bruce was my initial patient that I had. And as I was working with Bruce, Bruce and Mary Ann definitely like embraced this program as a whole. When I met with them initially, I also sat down with Traditions Hospice Intake Nurse, and we both kind of explained what our programs were, what the differences were, and how we kind of support each other and work together. So Bruce and I, we worked through a lot of like anticipatory grief and a lot of worry of what's going to happen to my wife when she's gone. And as I was working with him, we were seeing his wife's cognitive status start to decline with some Alzheimer's diagnosis, some concern for her. So then I was able to reach out to her doctor and say, hey, like we're kind of going to need to create a whole new end-of-life plan, because right now their plan was to stay at home till the end. But realistically, it's looking like that might not be an option depending on how her cognitive state declines. So we were starting to talk about, is assisted living an option? Like, what can we do? Rearranging some power of attorneys, some different things, recommending the driver's test for her, just for some things she forgot how to get out of her car one day when it was locked. So it was like a very sad situation. And then with this family and being able to be there with Traditions, their intake nurse, Debbie, her and I talked after in the driveway before I went home that day, and she was just like blown away that community health care was doing this and that we had this program. She's like, so if I get a patient, can I like tell them about you, that community health care has this? I said, as long as they're a community health care patient, absolutely. And she did just that, because a couple of weeks ago, I got a message from Krista saying that she had a patient come in whose mother-in-law was just placed on hospice, and they had a ton of caregiver stress, and Debbie from Traditions had told her about me. So it was really awesome to kind of see this now come full circle. So now Traditions knows, and they're telling our patients about us too, because they see the value in what we're doing, and I just think it's really cool.
Thanks so much, Amanda. Thank you. Awesome stories. So cool after last year's meeting to see patient outcomes improve. Why else are we here today? To enhance our culture. And I want to talk about culture because, like I said, I think it's the secret sauce that makes us who we are. So what is culture? It's a collective set of beliefs, behaviors, ideas, and practices that we share. It's the reason why organizations have sustained success over 37 years. Our culture drives expectations. Our expectations and beliefs drive our behavior, do what it says, and our behavior drives habits, and habits create our future. What does John say? A culture of greatness doesn't happen by accident. It's intentional. It happens when leaders expect greatness, and each person in the organization builds it, lives it, values it, reinforces it, and fights for it. And I see that in this room today. Culture beats strategy. Now, let's face it, community healthcare has a heck of a strategy. Our strategy is great. We have team care that honestly is trying to be emulated in multiple other areas of the country because of us. They saw how it's working here. People are asking us how to do this. Our strategy is good, but I think it's not just our strategy that makes us good, it's our behaviors and actions and culture within our operations and strategy that really makes us go. When I think of our culture, there's tons of words that come up. In the book, John talks a lot about loving, serving, and caring for others. And then the book's title is The Power of Positivity. I read this book earlier this year, and I was just blown away at how it made me feel. I don't know if all of you know this, I have 5 children, and I had 2 jobs here, and I don't have time to sit down and read a paperback book anymore. I have a big pile of them by my bed, and I fall asleep before I can do it. So I do audiobooks in the car now. And I would get out of the car after listening to a chapter of this book on my way to work and feel like I could just conquer the world that day. And so it's pretty amazing that we are able to bring John's vice president of teaching and of positivity, Julie Nee, today. Real quick, I want to give you a little recap, though. Positivity. Positive people live longer. There are multiple studies on that. Positive work environments outperform negative work environments. Positive, optimistic salespeople are more successful. Positive leaders are able to make better decisions under pressure. Marriages are more likely to succeed. Anyone ever hear of the 5-to-1 rule? If you don't have 5 positive interactions with your spouse for every negative, your divorce rate goes up. Positive people regularly express positive emotions, and they are more resilient when facing stress, challenge, and adversity. We don't get many of those in life, do we? Positive people are able to maintain positive and broader perspective, see the bigger picture, come up with solutions, whereas negative people have a narrower perspective and tend to focus just on the problem. Positive thoughts and emotions can counter negative. You really can't have both in your head at the same time. You can't have faith and fear at the same time. Positive emotions such as gratitude and appreciation have helped people perform better. Athletes are in that study, but also at work. And positive people have more friends. That's pretty cool. What are the health benefits? Optimists are half as likely to be readmitted to the hospital after a heart surgery. Pessimists are 3 times as likely to have heart attacks. Whoa, that's a lot. Pessimists are 3 times as likely to get hypertension. Optimists are less likely to get viral infections. There ain't many of those going around right now, are there? This is crazy. Pessimists just have an overall mortality rate almost 50% higher. Carotid artery disease progression in postmenopausal women, who thought of that study, actually progresses slower in positive people. And positive results in better coping skills, less distress when adapting to change. What's the cost of being negative? 90% of doctor visits. Do we all agree with this? Almost everything we see can be stress related. Negative employees can have a hugely negative impact on our customers or patients. At work, negative interactions compared to positive can decrease the productivity of the entire team. I read a study where if you sat someone within 15 feet of a high performer, their performance goes up like 20 or 30%, just being in the vicinity. And if it's negative, their performance drops. One negative person can have the miserable effect in the office. We know this. 90% of anxiety at work is created by 5% of the negative people. Negative emotions have decreased our lifespan. They increase our risk of vascular disease, stress, and have fewer friends. So what is our opportunity? Our opportunity is massive. We have 80,000 or more patients that come to the people in this room for health care. Do you guys know that? It might be higher than that. We ran those numbers a while back. It could be close to 100,000 now. Do you know how many people that is? Our opportunity is huge. Every person that walks in our door, we could be giving the kind of feelings that this book gave me and what you guys are saying about all the things you've done for our patients. Not only our patients, but each other, right? Being positive at work, when we all have a positive day, can really make a huge difference compared to a negative. And this was a question, I can't remember if it was in the book or not, but when you look at yourself in the mirror, if everyone in community healthcare behaved exactly like me, what would our company be like? Ouch. That's a good question. So with all of that and how great and what the opportunity is for us to be positive, I'd like to bring up our speaker.